Procedure for inserting hemodialysis line into the internal jugular vein. First, jugular vein area should be cleaned with betadine spirit and make area anesthetized by injection lignocaine. Insert large bore needle into internal jugular vein and check blood flow. After confirming that it is inserted into the jugular vein, a guide wire should be inserted into it. While doing this, confirm whether the guide wire is moving smooth or not and then push it forward. If there is any obstruction, remove the guide wire and recheck. After inserting guide wire, apply pressure with gauze and remove the upper needle. While doing this, leave the guide wire in place for now. Then the line should be properly dilated with small tissue dilator. While doing this, confirm that the guide wire slightly should be out of the dilator. During procedure, intermittently check patient's heart rate and oxygen saturation on cardiac monitor. Then opening should be slightly widened with large tissue dilator so that the hemodialysis line can pass easily without any obstruction. While doing this, keep talking with patient in between so that you know that the patient is conscious. Then take HD catheter for insertion. Before inserting HD catheter all the way in, pull the inner guide wire within catheter out until it is slightly visible from HD catheter's other end. After confirming that a slight guide wire has come out, slowly push the HD catheter in jugular vein. After the HD catheter entered in jugular vein up to the bifurcation, then taking out the entire guide wire from catheter and giving a gauze pressure there. Once you do this, as soon as blood starts to come out of catheter, you should place a clamp there and close it. To check whether the inserted catheter is in the jugular vein or not, backflow should be checked from both lumens. Then push 5 cc sterile NS through both lumens and clear both lumens so that in lumen does not accumulate blood and cause clot. Then placing a clamp on both lumens and clean the area around the line. No compromise for sterile methods in the entire procedure. To keep the line in proper same place or for avoiding line moving or floating up, you should suturing it with local skin to keep it fixed. Do suturings on both sides. Then to prevent any kind of infection at that place, place a sterile gauze dressings and close it by dynaplasticing on top. Pack and close properly, applying dynaplasticing around line. This reduces the risk of secondary infection related to the central line. After all procedure and jugular vein along with chest X-ray should be done to confirm whether our line is in proper position or not.